Welcome to another episode of Notable Perspectives. I'm your host, Dr. Muthu Alagappan, and today we're joined by Puneet Singh. Puneet serves as the CEO of Quartet Health, and prior to Quartet, Puneet was the Chief Growth Officer of the Diversified Business Group at Anthem, and prior to that was the Chief Development Officer of Aspire Health. He's a true veteran in the healthcare industry and the digital health landscape. And Puneet, it's such a pleasure to have you on today.
It's great to be with you. And Muthu, thank you for having me and great to have this conversation.
Great. Well, I'd like to start at the beginning of your career. How did you get into healthcare and what has led you to stay in it for this many years?
So I entered into healthcare by accident. I actually never thought I would get into healthcare. My dad is a physician, and I always just thought I would do something different. I was really interested in media and entertainment in the early days, and a few things drove me to healthcare, but most notably, family and personal experiences that went really poorly in healthcare. And seeing that firsthand and being a consumer firsthand made me think this is a problematic sort of experience set in industry. And I then started my business career in investment banking, accidentally landed in the healthcare group. I was not planning on it. And when I was in the healthcare group, the economy went through a lot of changes, in some ways, much like it's going through now. 2007 was a huge boom. 2008, we saw a huge pullback. And then all of a sudden, healthcare became a significant area of focus with the Affordable Care Act and all the new legislation. And so personally, I felt like the healthcare space wasn't inspiring me in terms of the status quo. And then I happened to be in at a time and in an industry where healthcare became a very big focus. And so I said, hey, this would be a really cool thing to try to make a difference in. And one of the things that drives me is mission. And so the opportunity to do something better in the healthcare system at a time where the problem seemed really big, but people wanted to make a difference is what attracted me to the space.
I love that story, and we hear often in healthcare about people being drawn to the industry because of that mission alignment. Yet it's interesting that healthcare is often also an industry where there's tremendous amounts of burnout, ranging from clinicians to staff. And so, why do you think there is that sort of dichotomy where on one side, people are drawn to it for the mission, yet at the same time, many of them are also, experiencing higher levels of burnout than other industries are?
So I think the mission piece is the easier piece because part of my what I've observed is many people want to be part of a cause that's bigger than themselves and making a difference in the world and looking back and sort of feeling like one has made a difference. And I think both of us have young kids, and I think for me having a young son has inspired me to think about more than just me, but about my family and what kind of values we want to espouse. And so I think the mission is a natural big draw where we can look back and say, hey, we made a difference in somebody's life or made a difference in the space. I think the burnout comes from a few things. This is a hard and complicated space. And so there's a reason I think there's so much innovation and venture funding and people wanting to do things because it's a really complicated space. And it's complicated for a few reasons. One is we all know the payment models are not sort of where they need to be. And so one reason for burnout is it's generally most of the industry is still based on units produced. So the more activity you do, the more you get paid. Well, in that any environment like that, you're going to have burnout because you just end up doing more and more activity. And so I think that's one piece of it. The second is change is slow. We've made a lot of progress in healthcare, and some of the problems that have been identified decades ago are still problems. Great example would be mental health. We've made tremendous strides in mental health, and we have so much more to go. So I think that's the second thing. And the third thing is, I think making a difference in the space requires a few perspectives. You need a perspective of understanding the space. I think it's hard to transform the space without deep knowledge of what the problems are. You need a very optimistic and change oriented view so that you can really make a difference. For private companies or people who are entrepreneurs, you need the ability to raise capital and create a business plan. And so you need a lot of skills to make a difference in the space. It's hard to just show up one day and have an innovative healthcare company. And so it takes a long time to get into the space and then a long time to change the space. And naturally, what can happen along the way is people can get burnt out or feel like the change is too slow. But to me, every problem that's hard is gonna be take time. But that to me is also the inspiration, is feeling like the prize is, big enough and the impact is big enough that it's worth fighting through those challenges.
You've been in healthcare your entire career. I think in the last few years, we've seen a lot of people from other industries come into healthcare and bring that outside energy and outside, ideas and enthusiasm into the space. Any thoughts on how that sort of marriage of different industries coming into healthcare has worked so far? And how do you think about it at Quartet when you're sort of building the team and the company?
I'm a big believer of diversity of skills and experience and background. I just think that's the way. I think if everybody's tackling the problem in the same way or from the same vantage point, you're not going to get a different result. And so I think everybody would say healthcare needs to get better and has to get better. Well, without new ideas, it's not going to get better. And so to me, I actually think the diverse perspectives are critical and move things forward, even within our team. So think we're a tech-enabled care delivery organization. We have about 250 providers. We have about 60 care navigators. We also have people who have data science backgrounds, engineering backgrounds, finance, legal, HR, business development. I mean, we got a range of skill sets, and a big part of what we do is have interdisciplinary team meetings. And so anytime we're tackling discussions, we want a clinician in the room. We want a technology person in the room. And we do that deliberately because if we're going to tackle the space in a different way, we got to work together. So I think that's one piece. The second piece is your end user. Your end user in healthcare isn't one type of person. It's everybody. And so if you're serving everybody, but you only have one perspective of people tackling the problem, you're never really going to get the perspective of the end user. And so I think it's a really important thing. And I think the more great talent, great capital, great ideas come to the space, I think there's so much opportunity that I think it's a great thing.
You mentioned Quartet, and I want to go, a little deeper there. Some of our listeners may know about Quartet. Hopefully they do. If they don't, do you mind just giving everyone a brief introduction into what the company does and where the company's headed?
Yeah, so think about our mission is very simple. Our goal is speed to quality mental health care for all. We all know the access challenges around mental health. The prevalence of mental health conditions is rising. I'm hopeful that stigma will decline. And there's a shortage of providers and certainly tech-enabled providers. And so our whole mission is better access to high quality mental health care. Now, we also focus more on patients with more moderate to serious mental illness. When you think about health equity, oftentimes those with the most complex mental health conditions have the hardest time getting to care, both in terms of wait times, in terms of access, in terms of providers, in terms of resources. And so we do four things. We help identify patients who have a significant need. We use data around that. We get warm referrals from providers around that. So we identify patients. That's the first. Second is we engage patients. We use technology and we have care navigators to help patients understand their needs and help them get to care. Third thing is we get them to care. We have providers and we have a network of thousands of providers through a Care Partners program where we help patients get matched to the right provider at the right time for them. And the fourth thing we do is we evaluate. We say, did we improve quality of care? Did we improve the patient experience? Did we reduce unnecessary costs, things like emergency department visits, because we're getting ahead of the patient's needs? And so that's very simply what we do. In the past year, we've served more than 500,000 patients. We operate in 30 states. We serve health plans, health systems, risk-bearing providers across the country. And we're going to double again next year. So we should have over 500 providers fully on staff, as well as thousands of additional providers who are part of our network. And so that's very simply what we do. And it's a mission that is really important to us and personally very important to me as well.
Thank you for that background, and thank you for working on this. Clearly, an area where, as a country and just as a society, we can do a lot more, and definitely need these types of initiatives and companies in place. There's a certain avenue of sort of business building which argues you should maybe pick a few core competencies that you want to really specialize in, and then partner with organizations in other areas. Do you subscribe to that sort of type of philosophy? And if so, what are the, one, two, or few things that you think Quartet is really, that's the core competency that you're kind of dialing in on?
I do believe in that because focus is key. And so trying to do everything in a complicated industry is hard to sort of move the needle on. If I were to choose three core competencies, I would say, in no particular order, number one, very strong clinical quality of care. I think the key to making a difference in this space starts with quality. And I think that's one of our key differentiators is we have a group of clinicians who are really talented and a network that's really talented. And so high quality care is a critical piece for us and always will be. The second piece is our data and technology. So if we're going to have great clinicians, we need to arm them with the right information at the right time, leveraging the right technology. We know that if you get the right information in the hands of the right clinician at the right time, good things will happen. And so technology, data, analytics is a big part of what we do. Third part is differentiated and value-based contracts. So the fee-for-service world is a challenging world for providers. You asked about burnout. I would argue part of the reason there's burnout is fee-for-service. And so this idea of I'm going to see a patient for a few minutes again and again and again throughout the day, I think it's harder to make an impact. And I don't think that's the way of the future. And so we have a number of differentiated value-based contracts, both where we deliver care and where we enable other providers to deliver care. And so I would say those are our three differentiators: really high quality of care, technology, data and analytics, and value-based contracts.
When I joined Notable, I think it was quite some a physician and came from a academic medical world. And joining Notable was sort of eye opening to understand how difficult it is to build really high quality, robust technology. And there's this new breed of company that is tech enabled, service providers, and you're sort of in that middle ground as both a technology company and also sort of a care provider. How do you think, you could go and try to rebuild many sort of core technologies yourself, the EMR, the patient intake platform, much more. How do you think about where you'd like to partner on technology initiatives versus what technology pieces you want to own in-house?
Yes, so it all starts with mission and focus. And so, our goal is we want to serve millions of patients and help them get good quality of care. So the second you define that mission, uh, one has to partner because you can't do everything on your own. And we think about partnerships in a bunch of different ways. We think about network partnerships. We're not able to reach every patient with our provider base. Even if we get to thousands of clinicians, the need is too great. So we need to partner on the network side. We need to partner with health plans and our customers because that's one of the ways we can better serve patients. And absolutely, we partner on technology and data and analytics. That's a critical piece for us. Part of this is determining where we can be most effective and most useful. Things like some of the data and analytics, we actually see a lot of value of doing that in house. The ability to run algorithms to identify high needs patients, the proprietary matching ability to understand a patient's needs with the right provider, leveraging some of our data and analytical capabilities to understand, are we improving cost of care? Are we delivering an ROI? Real time analytics to help our providers. Those are critical pieces. Stuff we're not going to do. We're not building our own EMR. We're not building our own practice management. We're not even stuff like measurement based care we're partnering on. Things like the patient experience. Some of those pieces we're building, many of them we're partnering on. How we think about patient satisfaction, how we think about the intake process for a member. If things have been defined and invented by great companies, innovative companies, companies doing unique things in the market, and they're ahead of the curve, we love to work with them and bolt into them and partner with them. That to us is it allows us to move our mission faster. So we're never going to be in a boat of building everything in house. I think that's way too complicated and frankly will take way too long. And so for us, it's about getting high quality partners, moving with pace, and using that as a way to advance our mission. And I think that focus and also knowing where we believe we have a differentiated skill set versus where others have that and we can tap into that's been a critical piece for our technology build.
This is probably an appropriate time for me to mention that Quartet and Notable kicked off a partnership a few months ago, and so we are honored to be part of assisting in such a great mission like you all have. When you think about partnership more broadly, whether it's on kind of the piece of the puzzle that we work on or anything else, what have you learned in terms of picking a technology partner? What are the characteristics you look for? How do you vet technology partners? And any advice for healthcare providers and systems out there that are going through this type of, partner evaluation process?
Absolutely. So we do partner together, and a big reason why we partner together, and sort of the way that we've thought about it is a few buckets. One is values and mission alignment. So part of the way that we work together is helping build a really unique technology, and some of that is directly patient facing. And so we want to make sure that we're leveraging and building technology or leveraging best practices on the best ways to engage patients. And so if we can learn from you all or from others who have done great things and you have a secret sauce around that, we actually want to learn from that and benefit from that because we know that for patients, we want them to have the best experience and we can learn from others around it. And so that's sort of a big piece of what we think about. So the values alignment is sort of one key piece. The second is skill set and capability set. You all have unique capabilities. Obviously, you have a clinical background and technical skills, and so your team has a unique capabilities and skill set that can be helpful to us and to others. And then the third piece becomes speed to market because if you all have built unique capabilities and you already have those capabilities, then it allows others to go to market faster rather than building everything in house. So I would say it's really three things: it's leveraging best practices and know how from others, especially when that know how can be valuable to the end user. The second is leveraging interdisciplinary, multidisciplinary teams. We talked about the value of that before. And the third is speed to market. And so those to me are the reasons and the values of why this stuff is super important because the last thing we want to do, I think any of us want to do in the healthcare system, is reinvent the wheel. The other part of your question was if you're a provider or another provider out there, how would you think about this? I would come down to one's core capability set. And if it's different than companies like Notable, so if you're a provider out there and you're thinking, you know what, I don't have the skill set or the technical capabilities or the teams around it, then I think that's a great opportunity to say, well, how do I still deliver a great product, but maybe leverage other capabilities in the market to do that effectively?
First of all, I'm a very framework-based thinker. I like numbering out sort of reasons. So thank you for giving us that kind of clear framework on so many different questions. It's really helpful. I want to zoom out a little bit from Quartet and just look at the industry kind of more on a larger scale, the provider industry. Two of the big trends that I think a lot of people are quite worried about are the growing administrative burden and sort of the corresponding labor shortages or increases in labor cost. As a CEO of a company that delivers care, are these two of the bigger challenges you see in the industry, or are there others that are out there that you find more pressing?
No question. I was just with our people team for a full onsite today, and we said, "Hey, hiring in another industry might be easier because when you hire and attract great talent in healthcare, especially clinicians, you have to factor in several things. One is they have to be the right cultural fit. Quality, we talked about the importance of quality, and there's no question that there's a shortage of mental health providers in the country. And so when you take that, and then there's no question inflation is real. And so when you factor all that together, we spend a lot of time and energy thinking about our culture and thinking about being a best place to work for all types of people, but especially and including clinicians. We want a great culture, a great environment, a great model. And so just to give you a window, in September, we hired 30 clinicians and we're ramping that up pretty quickly. And so we need to make sure that we are very thoughtful about meeting clinicians' needs. Now, so the one piece is absolutely there's a clinician shortage and labor costs are going up. Now, then you pair that with the demand is not shrinking. There's actually tremendous there's more demand than supply. And so what we have to do, and a big part of what we do, is match supply and demand because not every patient needs the highest acuity care setting, or not every patient needs every type of team member. So matching, so we spend a lot of time doing intake and triage in our clinic, understanding holistically what is the patient's needs so that they get matched with the right provider. And that's really critical because if every patient gets matched with the same type of provider, you're going to have huge access issues. So that's one piece. The second is this is where technology, data, analytics, and care coordination becomes so critical. If you have a shortage of providers, not only do you have to match the right patient with the right provider, you have to make sure the provider is being used for the top of their license. And so we wrap around our providers care navigators, enrollment specialists, care coordinators, technology and analytics. And so, what does that mean? A patient with a more mild condition may actually benefit from CCBT, so cognitive behavioral therapy, but using digital types of tools or self serving tools. And they may not need to see a psychiatrist or they might not need medication, as an example. And so, we have to have these types of tools in our toolkit because patients have different needs. And to respond to that, we needed a sort of arsenal of clinically proven tools, and then we need to measure the efficacy of that. So that's a big part of what we do. And I think without that, frankly, I don't think we're ever going to be able to meet the demand without some of these tools.
That is very helpful. And I've seen some forecasts where, we could have a shortage of 400,000 nurses, 100,000 physicians in the next 5 years. And so you think about what are the levers we have as an industry to increase the leverage of the staff we do have. And I love that you outlined a few of those. It sounds like one of them is just better matching and utilization of the people we do have to the needs of patients and acuity. Another one you mentioned is augmenting licensed staff with, a team of folks around them that can, allow them to operate at the top of their license. And then a third one was the use of technology. And so, where can you kind of bring in technology to lever up existing workforces? We think about that a lot at Notable. Would love if you have any other anecdotes or observations you've had on where technology can be a form of leverage for sort of the not shrinking, but smaller workforce that we're often having to deal with.
So I think you nailed the framework, and sometimes the best use case can be personal experiences. So I see a therapist, and sort of my journey before I joined Quartet was I thought mental health can be very beneficial to all of us, including me. And so I went on sort of a search of how do I find a good provider, and this is part of the sort of inspiration for me of joining Quartet last year is I found it to be very challenging to find a provider. So I Googled online, hard to really determine who's high quality. And so I ultimately asked my PCP. My PCP connected me with a psychiatrist. That psychiatrist was out of network, only accepted cash pay. Then I realized I actually might not need a psychiatrist. I actually might need a different level of care. And then I actually realized there's a bunch of self service digital tools. And so I use a meditation app, I use a range of digital tools. And that actually helps me tremendously. And I actually don't really need to see that higher level clinician. And it's actually better for their capacity to see a patient with more appropriate needs. And so just going through that journey, which by the way was like a multi-year journey to kind of figure those things out, made me realize, wow, how many people are either having a hard time getting care or getting matched with somebody who's not the right fit for them, not because it's not a good provider, but because it doesn't meet their needs. And they don't even really know where to go. And so it's a very trial and error type of experience for me personally. And the reality is with some of those digital tools, I actually have scaled back even some of my visits with a therapist. And so that's a great example where if you think about the healthcare system, I was spending more for an outcome that I didn't really need and a pretty confusing patient experience. And instead, I can actually spend less, have a better experience, and a more seamless experience. And a lot of it just came from my own, frankly, random navigation of the system and asking around. And so those are the types of things that in any other industry, it's not so complicated. Just to build on this use case, my family and I, we moved to New York earlier this year, and we love to try new restaurants in New York City. Well, it's pretty easy. We go on an app, Yelp or Google Maps or anything. We look up great places. We book online and we go try out a bunch of places. If we were just randomly walking the streets trying to figure out what to eat, it's a pretty convoluted process. And frankly, we'd waste a lot of time and not really benefit from any level of basic technology and data. And so no other industry would we really accept the sort of roaming around trying to figure out the right care at the right time. Everybody knows that's expensive and inefficient and a poor experience. And so this is really the time in healthcare where we say, look, we're not going to stand for that experience in healthcare either and really make a difference in the space.
Those were great examples of where technology can improve the patient experience and the experience and sort of the quality of the care that's being delivered. You mentioned also, expecting to double the size of your kind of care delivery organization in the next year. How do you think about technology in terms of growing the number of patients you can serve, maybe without proportionally growing the number of support staff and administrative work that you have to perform? Is automation on the roadmap for you all in that sense, the way many health systems are thinking about it?
It's a really good question. Short answer is yes. And so, a big part of what we're doing and working on is an appropriate intake and triage process. And this is actually an area where you and I have spent a lot of time sort of brainstorming because if you think about the intake I describe with my personal experience, it's not really even an intake. It's just kind of me sort of thinking about what could be good. Imagine a world where using your own phone or computer, you could do a simple intake of your needs, your demographics, what you're looking for, and some simple assessments that are clinically effective and standardized. And the ability to do that gives one an ability to understand what are my own needs. When I started my own mental health journey, I had no idea without just Googling, what would be the right fit or need for me. And so imagine a tool on your phone where you could better understand that and then escalate. If you have a more critical need, that can escalate to a higher level resource. If you don't, you actually may never need a human interaction. You can actually be routed all the way to technology that serves your needs and everything in between. And so the ability to start there, to start with some technology and self-service capabilities, I think is really powerful. And part of the things that we've spent time on, and I think that are really powerful, are the ability to go into a primary care office and use a QR code and do your own self-service. Or by the way, it doesn't even have to be a primary care. It could be in your own home. It can be online. There's lots of ways of getting those tools in a standardized way. Again, think about a very simple analogy. I'll go back to the restaurant choice. You can go online and filter and say, look, I want Italian food. I want it at this time. I want it at this place. And I want to know what's a really high review. You're able to filter and understand based on your preferences what makes the most sense for you. So if you're somebody who says, I want this type of professional in this type of zip code, with this type of demographic, that ability and then getting information back allows one to self-serve much more effectively. And to your point, you then don't need the same level of traditional human interaction. I would go as far as saying the idea of everybody walking physically into a physician practice, filling out all the paperwork and forms by hand, sometimes having to do it multiple times, walking to the front desk, sharing it, scanning your insurance card, getting all these different bills afterwards and EOBs, going in and then having to do that multiple times. I just don't think that that's the way things are going to be anymore. I just think that whole world of sort of healthcare delivery is antiquated. And so a big part of what we do is automation of those things. And again, this allows our precious human capital and our great team members to do the highest quality labor and operate at the top of their license. So absolutely, I think technology and automation, just like in other industries, I think it's coming for healthcare, and I think it's going to actually be a good thing and be a better patient experience.
I've worked at some well-known academic medical centers where the patient experience could honestly be pretty terrible, but patients would still show up because that's the only place to get that level of subspecialty care, or that's just where you live and that's what's in network. And even if you're filling out forms on a clipboard and getting a bunch of mail, about your bill, like you have no other choice. And so, I often say healthcare is not just price inelastic, but it's also experience inelastic, where you can have a terrible experience, but you're often just stuck going to the provider that lives, that's nearby or that you have to go to. Is that changing? Should traditional health systems be concerned that now it's not enough just to exist? You actually have to delight patients, or they will go somewhere else. They will go to, tech-enabled players. They will go to Amazon One Medical. How real is that threat that patient experience now actually does matter?
It's a really interesting question. So I grew up in a small town in Ohio, and anytime my family or anyone had a healthcare escalation, we would drive an hour and a half and go to the Cleveland Clinic. And now, fortunately, we always had good experiences there. But why did we go there? Simply because we said the Cleveland Clinic has a good brand. We're going to go there. Like, that's really it. We don't know anything about the providers or anything. We just felt like, hey, we want good care. We're going to go to the Cleveland Clinic. Now that is oftentimes because there's asymmetric information. We as users or consumers or patients, we only know what we know. So through word of mouth, we believe that there's certain levels of care that are better or worse. And so we go there and we dedicate significant time there. What's going to happen over time is more information is going to be given to the patient. We actually view a lot of our work is enabling patients to have the right care at the right time and the right information at the right time. And so if you think about it, the shift towards home instead of high acuity, the shift towards virtual care, not just brick and mortar, the shift towards giving patients information, not just sort of speaking to them in the office, all these things are going to enable patients to vote with their feet. Right now, if I wanted a primary care doc, I can go online. I have more choices than I did 10 years ago. I think that's going to continue to happen. And so providers who have the right capabilities and can meet patients where they are, and I'll just underline who are really quality oriented, I think are going to win the day. Measuring quality is completely asymmetric information. I, as a patient or consumer, really, up until recently, have no idea who's a quality provider or not, other than just literally brand or word of mouth or anecdote. That's all going to change. Like for us, we are very focused on measurement based care. So you can track in mental health, are you getting better? Are providers helping patients improve their quality of care? That quality and the sharing of information and data around it, I think is going to wildly shift how people think about things. And they're going to go from perception to value. And value for them is going to be a mix of quality and price. And there's going to be more and more transparency. Now, I'm still, just random anecdote, I still think Cleveland Clinic is phenomenal. And we still go there if we need care. But now we get the option to understand more about information and data. And I think that's going to open up the world where patients can really get the right care for them. And somebody who didn't grow up like me next to a great hospital organization and maybe live in a rural location and there is no access to care, all of a sudden they can actually get the care in the comfort of their own home.
I want to end, since we're getting close to time, on just two even more zoomed out questions. One of them is just looking at technology in general in healthcare. There's a lot of investment going into healthcare technology across many different axes, everything from AR, VR to automation to machine learning and artificial intelligence. Where broadly do you think we are underinvesting in technology, or where would you like to see us, where would you like to see technology kind of go over the next few years in healthcare? Where should we put more chips that we aren't putting them today?
Um, yeah, a few ideas. One is I do think that some of the technology and tools can inadvertently support those. So when you think about health equity, oftentimes those with who come from underserved backgrounds uh, don't have those access to those tools. And as somebody who comes from an immigrant background and grew up in a small town, I actually deeply believe that people in underserved communities and people with especially minority or diverse backgrounds can oftentimes be, frankly, overlooked by the healthcare system. I would love to see more capital, more resources, more energy going towards underserved communities, minority communities, communities of color. I think there's a huge need there, and I would feel a lot of pride if we can make we're very focused on helping rural communities and people of all backgrounds around mental health, and so I think about Medicaid as a line of business. I think about again overall underserved communities. I even think for us we're focused on moderate and seriously mentally ill. These are patients who otherwise literally don't get care outside of the emergency department. So I'd love to see more tools and resources there. Frankly, uh, I would say somebody like me, I have lots of access to care. I have lots of access to tools, maybe too much access. And so I'd love to see more. I would love to see more sort of equal access for people of all backgrounds across the country in all sort of demographics. The second is, I think you can actually blow that out globally and say, look, there are places around the world where access to care is dramatically challenging. And again, I think about, my family's from India, parts of India and parts of Punjab, which is where my family's from, just no access to care. And the idea of mental health care, uh, there's zero resources. And it's not that they as humans don't have those needs. They might even have greater needs in light of uh, their demographics and their needs. So I'd love to see more resources towards international and domestic communities. Um, and there's a lot of underserved people where I think a lot of good can be done. And so we're hoping to make a small dent, but candidly, I think I would love to see more investment, more companies, more entrepreneurs. There is more, despite all the funding and all the people who are focused on it, there's still more demand than resources right now. And I'm hopeful all of us can make more and more of a dent there.
I sort of lied in that I want to follow up on that question with one more, which is we published actually a piece about this recently, but many people see healthcare, or see technology as potentially reinforcing disparities because, like you said, certain parts of the community are going to have more access to technology and use technology to maybe further some of the disparities that exist. We talk about bias and AI algorithms and much more. But we've actually had a strong belief at Notable that technology can actually help reverse and mitigate some of those disparities. And there's many examples of this, offering multilingual capabilities in a way where a human staff member may only know one, at most two languages. But through technology, you can enable a vast array of multilingual service offerings in a way that you can't replicate with people. Are there other examples at Quartet or just in general where you see technology as actually helping bridge the gap as opposed to, widen it like many fear technology will do?
So I do think for us, the ability to deliver virtual care and the ability to do that in a measurement-based way bridges more and more of the gap. And I think, a lot of our communities and places we serve are extremely underserved. And so, it's interesting. We've sort of plotted out across the country the sort of needs of populations. And there's many places where historically, without technology, without this access, without this care, people have literally nobody in their community who could deliver care. You can look at some rural places in the country, and we've mapped this out. In some states, there's like one psychiatrist or two child psychiatrists. And so I think more and more the technology, it bridges some of these gaps and provides more and more access to care. So that would be one example. I think there's so much more potential and opportunity, though, as we're going forward.
That's a good segue into maybe where we can end. We've spent some time talking about challenges in healthcare, labor shortages, administrative burden. What gives you the most optimism for the next 10 years in healthcare in this country or worldwide? What are you most optimistic about?
People like you, companies like Notable, others in the market, and I say that not just because I'm on your podcast. I think really smart and talented people who are tackling tough problems. That gives me a ton of optimism. I think I get so energized by seeing really smart people and really talented companies taking on really complex parts of healthcare. And what gives me optimism is I look around at different events or meet different companies, and I think, wow, there are so many in this people in this company who are passionate, who are mission oriented, who are super smart and committed. And I'm a big believer in the power of people and the ability for people to do amazing things. So going back to your earlier comments, I love the fact that there's a lot of venture capital and people coming into the space because it causes new ideas and fresh thinking. And so that gives me tons of optimism. I would say if it were the opposite, if it were just a status quo and we couldn't convince somebody to sort of enter the space or do something, I'd say, man, this is a little bit bleak. But I'm very optimistic because if every person who's making a difference or every person who's listening to this makes sort of a movement or does the best job they can to move the industry forward, it's going to be amazing how quickly things evolve. So that gives me a ton of optimism.
Couldn't agree more. The collective power of the people in the space is tremendous. And so, on that note, thank you so much for joining us today, Puneet. Really enjoyed the conversation and the insights, and it's a pleasure to chat as always. Thank you.
Great to see you. Thanks so much for hosting me.